The control of bleeding and blood loss during surgery has always been a major concern for perioperative patients. Through advances in healthcare technologies and science, newer methods for surgical hemostasis have been introduced. There are numerous topical hemostatic products available, and new products are introduced frequently. It's important for the perioperative RN to be aware of new and emerging technologies to provide safe nursing care to each perioperative patient. This video will review a representative sample of topical hemostatic products available in today's operating rooms. The word hemostasis is derived from the Greek word haemia, which means blood. Hemostasis is the arrest of bleeding or the interruption of blood flow. This can be accomplished physiologically through vasoconstriction and coagulation or by surgical means. Throughout history, there have been many surgical methods used for hemostasis. Traditional methods include applying pressure to the wounds, clamping a vessel with an instrument, using electrosurgery, and suturing to stop or control bleeding during surgery. Currently, there are a variety of hemostatic products on the market today to assist with the control of bleeding during surgery. All of the products we will discuss require a physician's or licensed independent practitioner's order. Topical hemostatic agents are not indicated for intravascular use. They are applied as an aid to hemostasis when traditional methods are ineffective or impractical.
Peggy, this is the Recothrom.
Okay.
5,000 units. Expires November of 2013.
Okay.
And then just remember that we don't ever inject the thrombin.
Okay. The products originate or are composed of human, animal, or synthetic sources. Products can originate from a single source or a combination of sources. Another safety concern for both the scrub person and the RN circulator. Products come in single packages or kits, and there are many small items used to reconstitute the product and assemble the delivery devices. These items all need to be accounted for during the surgical procedure to prevent patient injury due to an unintentional retained surgical item. The FDA is an agency within the U.S. Department of Health and Human Services and is responsible for protecting the public health. As you know, the FDA assures the safety, effectiveness, and security of human drugs, vaccines, blood, biologic products, and medical devices. Topical hemostatic products are classified and approved for use by the FDA. Information about each topical hemostatic product that is FDA approved is available on the FDA website under the headings of medical devices and vaccines, blood, and biologics. The perioperative RN should read the prescribing information, which is also called product information, product labeling, or the package insert. This information is provided by the company and is approved by the Food and Drug Administration, the FDA. The package insert includes details and directions for the physician or the licensed independent practitioner to prescribe the product properly, and it is the basis for how the company can advertise its product. The package insert includes details about the chemical description, how the product works, how it interacts with other drugs and supplements, what condition or disease it treats, who should not use the product, serious side effects, common side effects, and effects on special populations of patients such as children, the elderly, or pregnant patients. Products that have special problems, particularly ones that may lead to death or serious injury, may have this warning information displayed within a box in the package insert. This is often referred to as a boxed or black box warning. It is important for the perioperative RN to look for and read this important information when reviewing the package insert for each topical hemostatic product. Perioperative RNs can find the package inserts in a variety of ways. They come in the package with the hemostatic product. They are on the company's website, on the FDA website, and by request from an industry representative. Patients may be allergic or exhibit hypersensitivity to topical hemostatic agents. Be familiar with the origin or source and composition of the topical hemostatic product, and do not use if the patient has known allergies. Religious and cultural concerns may need to be explored. Read the package insert to determine if the products are approved for use for special populations of patients, for example, pediatric or pregnant patients. For many topical hemostatic products, the safety and effectiveness has not been established for use in the pediatric patient, the pregnant patient, or the nursing mother. It is important to review and follow AORN recommended practices for product selection, medication safety, and the medication use process to help guide you with the best practices when using topical hemostatic products. A multidisciplinary product evaluation and selection committee should be established. Oversight and management of the topical hemostatic products may differ among healthcare organizations. Topical hemostatic products may enter the organization through the materials department or the pharmacy, depending on the healthcare organization's policies and procedures. Although topical hemostatic products can be classified as medical devices, blood derivatives, and biologics, the medication use process is an effective way to become familiar with all phases from acquisition through patient use, monitoring, and disposal. Preparation and planning for the use of the topical hemostatic products should begin before opening the sterile packages in the operating rooms. Some questions to think about before using topical hemostatic products. Is there preoperative information I should obtain from the patient before using this product? How do I obtain this product? How is it stored? How is it prescribed? Am I familiar with the indication and contraindications? How is it documented? How is it dispensed on the sterile field? How is it administered? Is there postoperative monitoring required after the use of the product? How do I dispose of the product if it is opened and not used? What information should be included in the postoperative patient teaching? It is important for the perioperative RN to consider each of these questions and use critical thinking skills to provide optimal outcomes for each patient. Now, let's briefly review the normal coagulation or clotting cascade. The coagulation cascade is a series of steps that can begin with the activation of the intrinsic, originated entirely within the blood system, or the extrinsic, originating from outside of the blood system, pathways of coagulation, and proceeds through a common pathway to form a fibrin clot. Each step involves zymogen activation. The activated zymogen catalyzes the activation of the next step in the cascade. The intrinsic pathways. During normal blood flow, there are coagulation proteins that circulate in the blood but are not activated. Blood flows briskly and moves these proteins through the vessels. The lining of the blood vessels, known as the endothelium, does not contain thrombogenic tissue factor or collagen. All of these activities promote blood flow, not coagulation. When an injury occurs within the blood vessel, the coagulation processes are activated in a series of steps in combination with calcium. The activation of factor 10 is the end of the intrinsic pathway and the initiation of the common pathway. Extrinsic pathway. This coagulation pathway is initiated by components outside of the blood system. When a disruption occurs in the endothelium, the subendothelium is exposed, which expresses tissue factor and activation of factors 7A and 10 in combination with calcium and membrane phospholipids. The activation of factor 10 is the end of the extrinsic pathway and initiation of the common pathway. Common pathway. The common pathway for the coagulation cascade occurs when the intrinsic and extrinsic pathways of coagulation meet or converge through the activation of factor 10. Activated factor 10 in combination with platelets, factor 5, and calcium converts prothrombin to thrombin. The role of thrombin in the coagulation cascade includes the activation of fibrinogen to a fibrin clot, activation of factor 13 to stabilize the clot, activation of platelets to assist sealing the clot, and the activation of factors 5 and 8. Topical hemostatic products are indicated for use as an adjunct therapy to traditional methods of hemostasis, and when traditional methods of hemostasis are ineffective or impractical. Topical hemostatic products interact at different phases of the coagulation cascade. For example, it is important for the perioperative RN to know that thrombin products may interrupt the normal clotting cascade. At this time, we have representative samples of topical hemostatic products being used in today's operating rooms. We have categorized the topical hemostatic products into these 5 categories: mechanical agents, active agents, flowables, fibrin sealants, and others. Let's review each category. Remember, this is a representative sample that is in today's operating rooms. We may not list every topical hemostatic product or have every type of product or every company's product for every category. And, as you know, new products appear on the market frequently. Mechanical agents are topical hemostatic products that are indicated to stop minimal bleeding. The mechanism of action is to provide a physical matrix for clot initiation and are commonly used for minimal bleeding. They are considered relatively safe, are easy to prepare, and are generally inexpensive. It is important to review the product insert prior to use. These products can swell and are not recommended to use in confined spaces. These are not recommended to be used in areas of infection, and it is important to know these products can cause a foreign body reaction if they are not removed. Mechanical hemostatic agents vary in composition and include porcine gelatin, bovine collagen, oxidized cellulose, polysaccharide spheres, and beeswax. Here are some of the commercial product names of mechanical agents that originate from porcine gelatin. These include gel foam and Surgiflo. Here are some of the commercial names of mechanical agents that originate from bovine collagen. These include Avitine, Heliostat, Instat, and Ultrafoam. Here are some commercial names of mechanical agents composed of oxidized cellulose products: Surgicel, Surgicel Fibrillar, Surgicel Nunit, and Surgicel Snow. Here are some commercial names of mechanical agents that are polysaccharide spheres. They include Arista and Vitasure. Beeswax combined with softening agent paraffin and isopropyl palmitate is a mechanical hemostatic agent. A commercial name for this product is bone wax.
Peggy, Dr. Smith has asked me to open this topical hemostatic agent for you.
Okay.
So I got this out of the cupboard. It's kept at room temperature, and we can go ahead and check the product information together. It expires December of 2013.
Okay.
It's Surgicel Snow 4x4.
Thank you.
And I'll go ahead and open that for you.
Okay, thank you. I know Dr. Smith likes these in postage stamp size pieces, so I'm going to cut them into those now.
Peggy, Dr. Smith has asked for this Arista.
Okay.
And this is the applicator. Here's the expiration date,
Okay.
August of 2013.
Okay.
And then this is the product with the expiration date of October of 15.
Okay. Dr. Smith, are you ready to use the product? It's important for you to know that the surface needs to be free of any oozing blood before you apply the product. Dr. Smith, the product is ready to use. Remember, this is a powder. Immediately apply a liberal amount of Arista AH at the site of bleeding. Quickly apply wound-appropriate direct pressure over the treated site. If bleeding or oozing continues, remove excess Arista AH and reapply. If any material, such as the surgical glove or sponge, adheres to the newly formed clot, irrigate the material with saline and carefully remove it from the treated site. Immediately upon contact with fluid, Arista AH will swell to approximately 5 times its original volume. Once hemostasis is achieved, excess Arista AH should be carefully removed by irrigation and aspiration. When using Arista AH with metaphor applicators, follow the instructions for use for the given applicator in order to appropriately apply Arista AH onto the wound site. We call our next category of topical hemostatic agents active agents. Active agents are relatively easy to prepare and are moderately priced. It is important to review the product insert prior to use. Active agents may vary in composition and include bovine thrombin, pooled human thrombin, and recombinant thrombin. The mechanism of action is thrombin converts the fibrinogen to fibrin to form clots, and thrombin activates the clotting factors. There are a variety of thrombin products on the market today. Thrombin can be used as a single application, in combination with gelatin sponge or powder, and as an additive to reconstitute some of the fibrin sealants.
Bonnie, I understand you have a sensitivity to bovine products.
Yes.
I'm just going to put this allergy band on you here.
Bovine thrombin should not be used if the patient has a bovine allergy. Bovine thrombin can stimulate an antigen formation and interrupt the clotting cascade. Active agents have the potential for antibody formation and viral disease transmission. There is a potential for infection transmission. Read the boxed warning in the package insert for bovine thrombin product. A commercial name of an active agent that is bovine in origin is thrombin JMI. Do not use pooled human thrombin for patients with allergy to human blood products. There is an unknown potential for infection transmission and interruption in the clotting cascade. A commercial name of an active agent that is pooled human thrombin is Evithrom. Recombinant thrombin is commercially manufactured, and to date, the clinical studies have not demonstrated if this product has produced antigens or impacted the clotting cascade. It is contraindicated for patients with known hypersensitivity to hamster proteins, and there may be potential for allergic reaction in patients with known hypersensitivity to snake proteins. This product may be used in combination with an absorbable gelatin sponge. A commercial name of recombinant thrombin is Recothrom. The circulator RN. Assemble all supplies. Checked for package integrity. Attach a needle-free transfer device to the recombinant thrombin and diluent and snap them in place by placing the vial flat on a surface and attaching the transfer device straight into the center of the vial stopper. Open the sterile empty 20 ml syringe package and apply the pre-printed "Do Not Inject" label to the syringe. Draw up the 20 ml of the 0.9% sodium chloride diluent into the syringe. Remove the diluent-filled syringe from the diluent vial and attach it to the transfer device on the recombinant thrombin vial. Transfer the 20 ml diluent from the syringe into the recombinant thrombin vial. The vacuum in the vial facilitates the transfer. Leave the syringe attached and gently swirl and invert the vial until the powder is completely dissolved. Use the same syringe and draw up the recombinant thrombin solution. Communicate with the scrub person and state the name and expiration date of the product. Show the product vial and diluent to the scrub person. Dispense the recombinant thrombin solution in a sterile bowl using sterile technique. The scrub RN. After receiving the product into a sterile basin, label the basin with the product name and dosage. Using sterile technique, draw up the recombinant thrombin solution into a syringe and label the syringe with name and dosage. Make sure the products are labeled after they are drawn up or after being placed in the basin. This is an AORN recommended practice. This product can also be sprayed onto the site of bleeding using a spray kit assembly and a spray pump. This product can be used in combination with a gelatin sponge. We call our next category of topical hemostatic agents flowables. Flowables are topical hemostatic products and are effective to stop localized bleeding. The mechanism of action is that gelatin granules cross-link into a matrix and swell for a tamponade effect, and the thrombin provides a hemostatic effect. They are relatively easy to prepare and use and are generally more expensive than active and mechanical agents. It is important to review the product inserts prior to use. Flowables vary in composition and include bovine gelatin and pooled human thrombin and porcine gelatin with or without thrombin. It is important to know if the patient has bovine or porcine allergies. Flowables have the potential for transmission of viral or prion disease. There is a potential for transmission of infections. They are not to be used with blood salvage devices or cardiopulmonary bypass circuits. There is a risk for swelling. It is reported that these products are approved for all surgical specialties except ophthalmology. They absorb in 6 to 8 weeks. A commercial name for a flowable that is bovine and pooled human thrombin in origin is Flocio. A commercial name for a flowable that is porcine gelatin in origin combined with or without thrombin is Surgiflo.
Peggy, here's the Surgiflo, and the expiration date is August of 2013.
Okay. We call the next category of topical hemostatic products Fibrin Sealants. Fibrin sealants are topical hemostatic products and are effective to stop localized and diffuse bleeding. The mechanism of action is the combination of thrombin and fibrinogen mixed at the site of application. The thrombin cleaves fibrinogen to fibrin that forms a clot. They are usually more complex to prepare and use and generally the most expensive of the products available. It is important to review the product insert prior to use for each hemostatic product. Fibrin sealants may vary in composition and include human plasma-derived fibrin sealant, the patient's own plasma and bovine collagen, human fibrinogen and human thrombin on an equine collagen sponge, and using the patient's own plasma in an automated device to create a fibrin sealant. Fibrin sealant products that originate from human blood products have potentials for transmission of infection, including virus and prion diseases. There are potential for foreign body reaction, swelling, tissue compression, and immunologic and coagulation complications. There are also reports of air embolus, tissue rupture, and gas entrapment. Hypersensitivity or allergic anaphylactoid reactions may occur. Package inserts may state, "Do not use with blood salvage devices or cardiopulmonary bypass circuits." It is important to know the patient's history. According to the package inserts, if the patient has known allergies to bovine or porcine, and the products originate from these sources, those hemostatic products should not be used. Systems differ in terms of storage and application. Human plasma-derived fibrin sealants are a two-component hemostat and sealant. Commercial names for these fibrin sealants include Artis, Evicel, and Tecil. Another composition of a fibrin sealant is the patient's own plasma and bovine collagen. A commercial name for this type of fibrin sealant is Vitagel. Another composition of a fibrin sealant is human fibrinogen and human thrombin embedded onto an equine collagen sponge. A commercial name of this product is Tacocel. A fibrin sealant can be created using an automated device using small amounts of the patient's own plasma. This process requires a trained technician for processing. A commercial name for an automated device using the patient's own plasma to create a fibrin sealant is the CryoSeal system. The AORN circulator will prepare the thrombin.
Expiration date of January of 2015.
Okay. Without touching the sterile cups or the sterile rubber stopper, the circulator will hold the metal rim of the vial and place into the vial cup being held by the scrub person. The AORN circulator will make sure the vials are seated firmly in the vial cups. The scrub person will hold the vial cup upright, press each vial into a vial connector, being careful not to contaminate the sterile cup or cup connector. The scrub person will turn the device over so the vials are facing upward. We'll aspirate all the biologic into the syringes. It is important to aspirate slowly to minimize the formation of air bubbles. The next category of topical hemostatic products we identify as others: cyanoacrylates, glutaraldehydes, and PEG polymers. Each has its own unique characteristics. Let's start with the first group in our others category, cyanoacrylates. Cyanoacrylate is a synthetic, sticky substance. The mechanism of action is the liquid monomers form polymers and glue surfaces together. There are cyanoacrylates that are synthetic skin adhesives. A combination of liquid monomers form polymers in the presence of water and act as a liquid topical skin adhesive, which can be used as a replacement for sutures. It is important to review the product insert prior to use. These products are fast-setting adhesives, primarily used on facial, extremity, and torso wounds. It is reported they attain the strength of healed tissue after 7 days. Synthetic skin adhesives should not be used in the presence of infection, in areas of ongoing bleeding or incomplete debridement, on mucosal surfaces or on hair-covered surfaces. They should not be used where the skin will be stretched or high-tension areas such as knuckles, knees, or elbows. These products should not be used where the skin is regularly exposed to body fluids. These products should not contact the eyes. Do not use for patients with hypersensitivity to cyanoacrylates or formaldehyde. Commercial names for cyanoacrylate synthetic skin adhesives include Dermabond, Dermabond Proneo, Liquiband, and Surgiflo. There are cyanoacrylates that are synthetic tissue sealants. A combination of liquid monomers form polymers to create a synthetic mechanical tissue sealant. It is reported that this product creates a physical seal within 2 minutes after application. The indication for synthetic mechanical tissue sealant is as an adjunct hemostatic agent for vascular reconstruction by mechanically sealing a suture line or graft. It does not replace sutures, staples, or the mechanical closure. It is an adjunct to achieve hemostasis. It is important to review the product insert prior to use. Do not use for patients with hypersensitivities to cyanoacrylates or formaldehyde. Reports indicate the safety and performance of these products have not been demonstrated for use in children and pregnant patients. A commercial name for cyanoacrylate synthetic mechanical tissue sealant is Omnex. The AORN circulator inspects the integrity of the package, checks the expiration date, communicates with the scrub person, and visually and verbally together validate the name, strength, and expiration date of the packages, opens the sterile package using excellent sterile technique, and dispenses to the sterile field. The scrub person communicates with the circulating RN and verbally and visually together validate name, strength, and expiration date of the packages, removes the applicator and holds the applicator with the cannula tip pointing downward. Apply pressure to the applicator lever to crush the inner glass ampule. Then release pressure on the applicator lever. Squeeze the applicator lever again, allowing the liquid to completely express into the cannula cover, known as the mixing chamber. Avoid creating excessive foam or bubbles by expressing the liquid slowly into the mixing chamber. Then release pressure on the applicator, allowing the liquid to draw back into the applicator unit. Repeat this mixing step 2 additional times. Thorough mixing is essential for optimal performance. The liquid should fill approximately 1/3 of the cannula cover. Remove and discard the cannula cover. The applicator is now ready for use once the target surgical field has been prepared for the application. The product is ready for use by the surgeon or licensed independent practitioner. Storage. Store unopened packages at room temperature between 20 to 25 degrees Celsius. The product information states to allow up to 2 minutes to pass to ensure complete polymerization of the product. The next group in our others category are glutaraldehydes. The mechanism of action is the glutaraldehyde cross-links bovine albumin to cell proteins at the wound site to form a scaffold. A surgical adhesive solution is formed when bovine serum albumin and glutaraldehyde combine. It is reported this product achieves a binding power in 20 seconds and full strength in 2 minutes. It is important to review the product insert prior to use. The glutaraldehyde is cross-linked with the bovine albumin. This product can be used in vascular procedures to seal holes around suture and staple lines. It does not replace sutures, staples, or mechanical closure. It is an adjunct to achieve hemostasis. It is reported as a good product for arterial bleeds. Glutaraldehyde is an inert substance that is never absorbed. Do not use this product in the presence of infection. Hypersensitivity to the product has been reported, and it is recommended to avoid repeated applications to the same patient. Reports indicate that it has not been studied for use in pediatric patients and should not be applied circumferentially to areas where tissues need to grow. A commercial name for this product is BioGlue. The AORN circulator inspects the integrity of the package, checks the expiration date, communicates with the scrub person, and visually and verbally together validate the name, strength, and expiration date of the packages, opens the sterile package using excellent sterile technique and dispenses to the sterile field. The scrub person communicates with the circulator RN and verbally and visually together validate name, strength, and expiration date of the packages. Removes the syringe plunger, and the applicator tips from their packaging. While holding the syringe upright, tap the syringe until the air bubbles in the solution rise to the top of the syringe. Continue to hold the syringe upright during the entire assembly of the delivery system to keep the bubbles toward the top of the syringe. Remove the applicator tip from its packaging and inspect the collar portion of the tip to ensure that the pointer portion is directly over the larger port. If not, rotate the locking collar on the shaft until the pointer is over the larger port. While firmly grasping the syringe nose upward, turn the cartridge cap 90 degrees counterclockwise and remove the cap by rocking it from side to side. Align the tip with a cartridge using the corresponding notches on each and place the tip on the syringe. Lock the applicator tip in place by pushing the tip firmly upward toward the syringe and rotating the collar 90 degrees clockwise. While keeping the syringe upright, align the small and large barrels of the syringe with the corresponding syringe plunger heads and slide the plunger into the back of the syringe until resistance is felt. The syringe delivery device is now assembled. Do not lay the assembled device on its side until all air has been purged. Before using, the syringe must be purged of all residual airspace, and the applicator tip must be primed. Storage. Store unopened packages below 25 degrees Celsius. Do not freeze. The final group in our others category is the polyethylene glycol polymers, known as PEG. The mechanism of action is the polymers mix and cross-link in the wound site. Chemicals known as polyethylene glycol are combined together as a synthetic topical hemostatic sealant or combined with a human blood derivative as a topical hemostatic sealant. Reports indicate the safety and performance of these products have not been determined in children and pregnant women or when used in large quantities. It is also reported in the product literature if the product contains human blood derivatives, there are associated risks identified. It is important to review the product insert prior to use. Polyethylene glycols, PEGs, are combined to form a polyethylene glycol hydrogel product that seals leaks in blood vessels. It does not replace sutures, staples, or mechanical closure. It is an adjunct to achieve hemostasis. These products are indicated for use in vascular reconstruction to achieve adjunct hemostasis by mechanically sealing blood vessels. A commercial name is Co-Seal. Storage. Store unopened packages of Co-Seal at room temperature, approximately 25 degrees Celsius. Use Co-Seal within 2 hours after preparation. Next, PEG polymers and trilysine amine solution combine to form a hydrogel product. These products are indicated for use to aid in preventing cerebral spinal fluid leakage and seal sutured dural incisions. The powder and solution are sprayed on and contain a blue dye for visualization. It is reported in the product literature that the sealant gel may swell up to 50% of its size in any dimension and should not be applied to bony structures where nerves are present. A commercial name for this product is DuraSeal Dural Sealant System. Next is a PEG polymer and human blood derivative product. Human serum albumin and polyethylene glycol, PEG, are combined to form a gel which is indicated for use to seal air leaks on lung tissues after the tissue has been sutured or stapled. A commercial name for this product is Progel Pleural Air Leak Sealant. Product reconstitution for Co-Seal. AORN circulator inspects the integrity of the package, checks the expiration date, communicates with the scrub person, and visually and verbally together validate the name, strength, and expiration date of the packages. Opens a sterile package using excellent sterile technique and dispenses to the sterile field. Scrub person communicates with the circulator RN and verbally and visually together validate name, strength, and expiration date of the packages. Prepares the liquid and the powder. Removes the lower cap on the transfer port closure. Do not remove the syringe clip. Rotate the syringe clip away from the other syringe plunger. This will allow ease of transfer between the liquid syringe and the powder syringe in the following steps. Remove the lower cap from the powder syringe. Connect the powder syringe to the opening on the transfer port closure. Transfer the liquid into the powder by forcefully depressing the plunger. Mix the contents back and forth between the syringes until the solid is completely dissolved, at least 20 times. Push the entire contents into the syringe contained in the syringe housing. Disengage the powder syringe by detaching the transfer port closure as follows. Grasp the powder syringe barrel, press the levers on the syringe housing, pull both the empty syringe and transfer port closure from the housing. Holding the syringe tips up, level syringe plungers and rotate the syringe clip to connect the other plunger. Hold the syringe upright and expel the air. Snap the applicator onto the end of the syringe housing. The product is ready for use by the surgeon licensed independent practitioner. In summary, there are a great variety of topical hemostatic products in today's operating rooms, and new products come on the market frequently. It is important for the perioperative nurse to be knowledgeable about the topical hemostatic products available for patient use during operative and invasive procedures. Follow recommended practice to provide appropriate perioperative nursing care. Assess your patients for allergies, hypersensitivities, and/or known reactions to these products. Become familiar with each product by reading the product inserts. Prepare the products as recommended by the manufacturer's instructions. Keep track of and account for the miscellaneous items used to assemble the products. Know about the origin and composition of the product. Is it a synthetic, human-derived, or animal-derived product, or a combination? Be familiar with product indications, preparation, and contraindications. Document the products according to your healthcare organization's policies and procedures. Patient safety is paramount for optimal outcomes in the perioperative setting.